Good morning, everyone.
Good morning.
Good morning.
Good morning.
Oh, good to see new members there. Stephanie, Daleen. Yeah, welcome.
Hi. Good to see you.
Morning.
Morning, Chase.
Morning.
You know, and Chase, it's probably something to mention during the meeting, but congratulations on the audit.
Oh, thank you.
Yeah, it looked
Thank
really
you.
good.
Went really well. Yeah.
Yeah, well done.
Thank you. Yeah, it was definitely a tough, not necessarily a tough audit, but definitely a tough year. 2021 is definitely was a unprecedented year. So it was nice to have a clean audit to go with that. That definitely is a good feeling.
Always good to have a clean audit.
Yeah, it means we're doing something right, I guess.
Yeah.
Yep, you are. Very good. Very good. I think it was a team effort, but led by you, Chase, and it's a lot of money and a lot of different things happened in that you had to go through on that audit. So to calculate or quantify and make sure that the auditors knew what was going on.
Yeah, it was definitely a different audit. They actually had to allocate a couple more auditors to it. The volume of the work, they did not expect that much volume. I tried to kind of warn them that 2021 was a crazy year with all the State Fair Park stuff that was going on. And it seems so long ago, honestly.
Yeah.
Weird to that feeling. And so yeah, no, it was really, and like you said, Ron, it's definitely a team effort with, Nathan and Lillian and Melissa. They're all very much a part of that, and they're all coding and looking at billing daily, if not weekly. So, yeah.
Yeah, it was well. It went well, and the auditors yesterday had nothing but praise for you and the team, and that was really good to hear.
Yeah, thank you.
I think they just had to say some stuff a lot, just kind of talk to fill the time a little bit.
It was fairly short. It was only like 15-minute exit interview. So
Yeah,
those are the best kind of audit meetings, right? When they're when they're only 15 minutes long. Those are the, when
exactly
they
right.
get long, that's generally not a great meeting.
Yep. Well, good morning, everyone. It's 8:30, so I will go ahead and open the meeting, and I will ask Mr. Ibach to do introductions of guests and staff.
Okay. All right. Commissioner Anderson.
Here.
Commissioner McKinney.
Present.
Commissioner Lindy.
Here, good morning.
Councilmember Byers.
She's here, but she's on mute.
I'm sorry, present.
All right. Dr. Atterbury. Dr. Atterbury's not on yet. Okay. Councilmember Duval.
Present.
Dr. Cleary.
Present.
Stephanie Algren.
Present.
Daleen Ackerman.
Present.
All right. And before we go on to YHD staff, just want to welcome both Stephanie and Daleen. This is their first meeting as citizen representatives of the Board of Health. So welcome.
Welcome, welcome. Thank you.
And then Yakima Health District staff, Andre Fresco. Okay, myself, Ryan Ibach, Chase Porter.
Morning.
Melissa Sixberry.
Sure.
Melissa. Okay. Lillian Bravo.
Here.
Sean McGee. Here, good morning. Nathan Johnson.
Here, good morning.
Dr. Bard.
Here.
Jocelyn Castillo.
Here.
Victoria Reyes.
Here.
James Elliott.
Good morning.
Andre Fresco.
It's here. Apologies.
And then Dr. Atterbury's still not on. Okay.
Thank you, sir. We'll move on now to any review of the items, any submissions by the public.
Yes, we did have one submitted written public comment. And this is from Ron Clark, and he wrote 2 areas of importance. Number 1, Hugh Bowman Ditch north of Roxton Road. Number 2, Bachelor Ditch south of Hughes Road. Health concerns due to extensive infestation of mosquitoes in above named areas. Upon advice from family physician, also John Wilson from County Health Department, Mr. Denver Camden lives at 10607 Roxton Road and has been unable to use his backyard for the past month for outdoor activity of any kind. Mr. Ron Clark lives at 10100 Hughes Road and cannot be outside after sunset due to mosquitoes. Usually high concentration of mosquitoes this year at both places. We would like this matter addressed at this month's meeting. Your attention in this matter would be greatly appreciated. We would like notification of result.
Thank you. Any further comment?
Ryan, I just want to let you know I joined the meeting.
Okay.
Thank you. Good morning.
Mr. Anderson, this is Dr. Clary. I would suggest that we forward that letter to the mosquito control district because that's their duty and they're the experts in mosquito control.
I would agree with that, sir. Well, let's have that forwarded to them.
Also for the record, the coroner, Jim Curtis, who's an ex officio member of the board, has also joined, and we'd like to welcome Jim for his first meeting on the board.
Oh, good morning, Jim.
Thank you.
May I take a second to address the Dr. Cleary's comment?
Sure.
Okay. Yeah, I did look into Yakima County Mosquito Control District 1 and Benton Mosquito Control District, as they have jurisdictions in Yakima County. The highlighted area in which they do their work in do not include the area which these addresses are, which is over near Wiley City. However, we'll still reach out to them. Maybe they know of some other folks that may work in that area, and we could also do some outreach to some folks that may have some jurisdiction over those irrigation ditches and other bodies of water that may be contributing to the problem. So we'll do some reaching out and try to find a solution.
Thank you, sir. And
Thank
give
you.
us a update on that when you have clarity, please.
Will do.
All right. Well, let's move on then to item number 4, the appointment of board chair and vice chair. Mr. Ryan.
Okay. So every year in January, according to RCW 70.05.040, we're required to elect a board chair and vice chair. And this year in January, the board decided to go ahead and select a board chair and vice chair for the first 6 months of the year because there would be a new board starting July 1st. And so at this point, we're with the new board, we're, according to the decision that was made back in January, we need to select a board chair and vice chair for the last remainder of this year. So we have 5 meetings, scheduled meetings left. So at this point, we would just need to make those nominations or anyone that's interested in being the board chair or vice chair.
Is there any nominations?
So I move to keep the current chair and vice chair until the end of the year.
This is Dr. Clary. I'll second that.
It's been moved and seconded to continue the chair and vice chair members until the end of the current ones until the end of the year. Any further discussion?
Only that I would agree with that. I think that makes sense.
Any further comments or questions or? All right, hearing none, please take a poll, Mr. Ibach.
Okay, if you're in favor of Commissioner Anderson remaining chair and Councilmember Byers vice chair, please state yes. If not, please state no. Commissioner McKinney,
Yes.
Commissioner Lindy.
Yes.
I don't think so. Councilmember Byers wouldn't be able to vote since she's. Would that be correct?
That's correct.
Okay.
That's correct.
Thank you for the clarification. Dr. Atterbury,
Yes.
Councilmember Duval,
Yes.
Dr. Cleary,
Yes.
Stephanie Algren,
Yes.
and Daleen Ackerman.
Yes.
7-0.
Okay, thank you. All right, well, we'll continue with that then. And so now we'll move on to number 5, the consent agenda. This will be done in a motion of all items listed with an asterisk are considered routine by the health board and will be enacted by one motion. There will be no separate discussions of these items unless a board member requests, in which that item will be removed from the consent agenda and considered in its normal sequence on the agenda. We have the June 29, 2022 Yakima Health District Board of Health meeting minutes. We have payment of accounts payable and payroll issued in June of 2022 in the amount of $818,868.94. Is there a motion?
Commissioner Anderson, I would move to adopt the consent agenda. Or approve it.
I'll second. Patricia Byers.
Been moved and seconded to approve the consent agenda as presented. Any further discussion? Hearing none. Mr. Ibach, would you take a poll?
Yes. If you're in favor of the consent agenda, please state yes. If not, state no. Commissioner McKinney,
Yes.
Commissioner Lindy,
Yes.
Councilmember Byers,
Yes.
Dr. Atterbury,
Yes.
Councilmember Duval,
Yes.
Dr. Cleary,
That was 2 votes.
Yes.
Stephanie Algren,
Yes.
and Daleen Ackerman.
Yes.
9-0.
Thank you. We will now move on to item number 6, the spotlight. Dr. Bard presenting on monkeypox.
Good morning, Commissioner Anderson. If I may, before Dr. Barr begins, I just wanted to share with the board, a thank you for your understanding. We had originally intended to do a spotlight on harm reduction, but given the severity of monkeypox and the spread, not just globally, but nationally, and certainly in our state, we thought it was timely to share what we knew with the board, because we anticipate over the next few weeks that things will ramp up dramatically. So we did not want it to be a surprise to you, and we certainly want to share what we know about a fast-moving illness.
Thank you, sir.
Thank you.
Dr. Bard.
All right, we have a slide set coming up.
Okay.
And if I may, the information that we have is really quite dense. So if you don't mind waiting until the end of the presentation so that we can certainly go back in terms of slides and information, but it may be helpful if we can hold questions until the end. Thank you so much.
Thank you.
All right, so a brief overview of what's been going on for the last couple months. I want to talk about what monkeypox is. Next slide. So this belongs to a family of viruses called orthopoxvirus, and it's in the same family as smallpox and cowpox. And you might see the terms variola and vaccinia appear in various articles. And those are the scientific names for those two viruses, smallpox and cowpox. Monkeypox generally infects non-human primates, and up until recently, it's been confined to Africa, where the monkeys live that primarily have the infection, and is transmitted to humans from time to time, but has never spread worldwide as it has now. And if it has, it's only been very small outbreaks from travelers. Next slide. So the epidemiology at this time is very different from the epidemiology in the past, as I suggested. The cases that are seen now occur primarily in men who have 10 or more sexual contacts. It's also in those who have traveled abroad, and persons under 30 years of age, which overlap much with the patients who have multiple sexual contacts. If they've had a history of sexually transmitted disease in the past year, which also reflects number of sexual contacts. Persons who have risk of HIV infection, which is a sexually transmitted disease and has the same risk factors, Worldwide, there's about 500 new cases a day. And multiple laboratories, fortunately, have been up and running with tests. So it's no problem for doctors in Yakima County to send off a swab specimen for a test, and are doing so as we speak. Next slide. So the symptoms of monkeypox infection of what we have currently going around are a bit different from the old version. This version usually starts with a flu-like illness, fevers, chills, aches, pains. There's a localized rash that's often seen at the place of initial contact, which in this outbreak is the genital area. And then once vesicles are seen in the genital area, new areas may form lesions in a sequential fashion with no particular body site that's preferential. One thing that's also different is oral lesions can occur, and perianal and rectal lesions can occur as well. And those are extremely painful when they happen. The regular pustules are also painful, but not as much. Once the vesicle is present, which is a fluid-filled blister, it's about 3 millimeters in diameter with a red border, the vesicles will involve in the pustules, which is basically the same size, but now it's cloudy fluid. Then those pustules will break and drain a small amount, and then they'll scab over. And if this sounds familiar to you, it follows the same pattern of maturity that a chickenpox lesion might. The scabs will eventually fall off, and then the skin will heal. And then when there's no more scabs, the patient is no longer infectious. So far, patients who are hospitalized, it's only because of severe pain. Next slide. So how does it get from one person to another? It is primarily skin-to-skin contact. This wouldn't be like a casual handshake, but contact like a prolonged hug or sex or laying in bed with skin-to-skin contact for an extended period of time. The secretions from the pustules will also get on clothing, bedding, towels, and contact with those fabrics and other objects can transmit the disease as well over a short period of time. Of course, washing them would completely eliminate the risk of transmission. They also should be handled with gloves because whoever's trying to do the wash shouldn't get in contact with any of the material that's on those linens. As I stated, patients continue to be infectious until all the scab lesions are healed. The reason that all this material is contagious because the virus is found in the vesicles, in the pustules, and on the scabs, and therefore any other surface areas where that material exists. Next slide. Fortunately, unlike COVID, we're starting out on the ground running with treatment. There's an antiviral capsule called TPOXX or Tecvirimat that is available for treating smallpox, but it's also effective against monkeypox. It has been approved for treating smallpox, and as such is available to treat monkeypox. And studies are ongoing to hopefully lead to approval of that, but it's not necessary for us to have the FDA approval for monkeypox since it's already approved for another disease. There's also an intravenous medication that's been around for a long time and used to treat CMV retinitis. It's called Cidofovir. It's also available. It's FDA approved. It's been on the market for about 30 plus years. And it's tricky to give, so it should be limited to people who've had experience administering it. I may be the only one in town that actually has had experience doing it since it was used at the beginning of the HIV outbreak. There is also a intravenous anti-vaccinia immunoglobulin. So that's immunoglobulin that's been harvested, and the immunoglobulin within it is directed against smallpox, but also attaches to and deals with monkeypox. The TPOXX medication is in the National Strategic Stockpile, so it'll be distributed following those rules. And we're finding out just how to acquire it, but it would be similar to ciprofloxacin that was in the stockpile when we had that threatened anthrax outbreak. For the people that should be treated, it's not just anyone. Because of the limited supply and the mechanism for getting it out of the strategic stockpile for now, the treatment should be reserved for patients who are at risk for a severe disease, so folks with underlying medical problems, patients who already have severe disease, pregnant patients, patients who are breastfeeding, patients with eczema, because the skin reactions are enhanced when there's underlying skin problems, and patients who have untreated, far progressed HIV infection. By untreated, they're not on antiretrovirals. Next slide. So another good thing is we have vaccines available that have been directed against smallpox, and they do work nicely against monkeypox. The two available are the Jynneos, and that's made up of a replication deficient virus. So this is a smallpox virus that has been modified and cannot replicate. So it just sits in the area that it's inoculated and generates an immune response. It's a two-shot vaccine and given 4 weeks apart. Because this is a replication deficient virus, there's no risk for spread to other people. The patient is immunized 2 weeks after the second dose, similar to the COVID vaccines. The other vaccine out is called ACAM 2000, and this is live smallpox virus. And for those of us that are old enough to have received smallpox virus, it's given the same way. There's a small needle with a little indentation in it where the liquid with the virus is contained, and it's poked into the skin several times. It's given as a single inoculation, and the virus in that area could spread. So care has to be taken until that heals over, that it not spread to other people who haven't been inoculated. Both vaccines are 85% effective at preventing monkeypox infection, which is a pretty good number for a vaccine, particularly one that's cross-reactive. And that might be last slide. Next slide. Okay. The other option we have with the vaccine is to use them as treatment. So if we've identified a case that's very suspicious, or in fact, we have the results of the test back, the vaccines can be given within 4 days of exposure, and it will prevent infection in many cases, or at least severe disease. After the 4 days, if the vaccines are administered, it will definitely decrease the severity of illness, but it will not prevent the disease. I think that's the last slide. And if so, I'm happy to answer any questions.
Dr. Barr, Jocelyn, if you could pull up the other ones, we do have just some information on cases within globally, nationwide, and statewide.
Can we go back to the shared screen? Okay, there we go. So the big orange circles represent many cases. The small orange circles are fewer cases. And when there's no circles, we don't know what's going on exactly. The lights in my room just turned out, so I didn't turn into a ghost. So you can see the United States, Spain, and several countries in Europe have very high numbers of cases. Next slide. Thank you. I'm in the light again. I want to keep you guys in the light too. So the blue indicates the state where it's been reported. So this is very up-to-date information. Just last week, there were 6 states that didn't have it. Yesterday, when we were talking, there were 4 states that didn't have it, and now there's 3 states that didn't have it. To say this is developing quickly would be an understatement. You have another slide up there?
Just to highlight on this one, if you go back, Jocelyn, one slide. Washington State is number 12 for cases, reported cases.
We're happy not to be number 1 here. All right, next slide. So here is our state distribution. King County, because of Seattle, and any other big major metropolitan area in the country has more cases than rural areas. But I expect our numbers, like everywhere else, will continue to climb. And I think Melissa just pointed out earlier that you had a case that was suspicious with very characteristic lesions, and the test has returned positive. So we do have a case in Yakima County right now. And that might be the last slide.
Dr. Barr, a couple of questions. Is this considered an STD, number one?
Well, I think it's not classified as an STD, but it's certainly true that it can be transmitted during sex. At some point, they may do it, but it doesn't require sex as much as, say, chlamydia and syphilis do, which also can be transmitted outside of sex. But I think the best way to think about it for now is that it's a disease that can be transmitted by sex as well as other skin-to-skin contact.
And the second, and you might have highlighted this, but just to reiterate it, how long is the sort of prodrome where they're infectious and yet don't have vesicles? Is that a long period or a short period in this particular?
Actually, yeah, it's pretty short, Dave. It's probably 3 to 5 days. And during that prodrome, there may be no physical evidence of it, but the patient's not infectious during that prodrome because it's the vesicles that transmit the disease. So once you see a macular rash that's present, by the way, for the 2 physicians on the board, this is another disease where lesions occur on the palms and soles. It's very rare to see that. The other one is syphilis. So we're telling providers that if they see a sexually transmitted disease with vesicles, that the specimen swab should be collected and sent for monkeypox, and the patient should be tested for the conventional sexually transmitted disease like HIV, syphilis, chlamydia, and gonorrhea.
And if I may add, Dr. Atterbury, one of our concerns is that regardless of whether it can be acquired through sexual transmission, the concern is also that it can be acquired through these pustules, through bed sheets, certainly. And then there actually is a concern. We hope that no one dies of this, but if you did have a decedent who did have vesicles, that person could still potentially be infected. So it is a wide-ranging illness at this point. Thank you.
Sean, you have a question? You're muted.
You're muted, sir. There you go.
Thank you, Dr. Bark. You identified a distinct risk group based upon behavior. The number of cases in women and children is being used as a marker more for the risk in the general population outside that one group. Could you address how many cases have occurred in women and children in the US and in Washington?
I don't know the numbers for Washington. I think the numbers countrywide, I'm not intimately familiar with, but 97% of the cases are in the population I described. There are reported cases in children. One of the reported cases, the child was cared for by a patient that had monkeypox. And women still are a small percentage, but I can't quote you the exact numbers, and they're going to change weekly, maybe even daily. So
if you go to the next slide, Jocelyn, I was able to, this is information that came from presentation from the Department of Health, but this does have your some of the demographics that you were asking for, Dr. Perry.
very timely, Melissa.
Stephanie, you have your hand up.
Hi, I have a couple of questions. One, if a person has monkeypox, but they're not able to qualify for taking the medications, how long does it take? What's an average before those pustules are scabbed over?
It'll probably be about 10 to 14 days before all of the scab lesions have lost their scab. So it'll require some care for that time.
And my second question is, what do you think, or what do other scientists think is causing this outbreak?
You know, it's hard. I think we all wonder about that. You know, why did this escape now? The virus is very similar to one of the strains that's present in Africa. Unfortunately, this is the less virulent of the strains. And even so, in Africa, about 11% of the cases actually die. But the population in Africa has a lot more underlying medical problems, and resource availability is down. So it's unusual. I think part of this may be due to the pandemic indirectly. So people are staying inside more. They're, associating closer with people that they might know. And it may be more of a behavioral thing than actually a change in the monkeypox virus itself. So coronavirus may be continuing to hit us in the head with this secondary infection being spread so easily.
If I may, Ms. Ogren, it's a great question, and I think Dr. Barty answered it well. But one of the things that is often overlooked is that the majority of the world is not vaccinated against COVID-19.
Oh,
so
that's a great point. Yeah, that's.
Well, yeah. So I think what we're going to see are as a cascade of events over the next few years of circumstances that, as Dr. Barb aptly said, is either scientific or societal, but we will see circumstances where people have made decisions that lead to their health being depressed in a sense, and then they may be more capable of contracting something like this. Thank you.
And if I could add to that, the smallpox vaccine was stopped being given, I think it was 1980 or the late 70s, because basically there were no additional reported cases. And with that, one of the reasons under 30 may be so prominent is because none of those people are vaccinated for smallpox.
And get treatment without having to have.
Any further comments or questions?
I have a question, Commissioner Anderson.
Really not sure.
Go ahead.
So I was trying to follow the last part of the conversation. And so Dr. Barg, is the intimation that people who are vaccinated for COVID or not vaccinated for COVID makes them more or less susceptible either category to monkeypox?
So the COVID vaccine operates in a particular, completely different way than the smallpox vaccine for people who have gotten a vaccine for monkeypox. The only thing that might weigh into it is that COVID may make you sick at a time that you may be more susceptible to having severe monkeypox. So be like an underlying illness if you have COVID. If you're vaccinated against COVID, it will probably have no effect on the severity or whether you get monkeypox. They're independent events.
Well, we'll just pray.
Thank you.
God brings the resource.
Thank you. Any further questions or comments?
I think there was just a couple more slides. Jocelyn, if you can go to the next.
Oh, okay. Go ahead.
This one just kind of shows the trends of cases within Washington State, and you can see it's trending upward for cases. This is as of 7/22, so obviously we have more cases than that now, but it just kind of shows the dotted line shows incomplete information and what the trend is looking like. Next slide. Oh, and that's it.
Okay. Any questions about the slides or anything?
Yeah, I would like to know if the slide packet has been forwarded or if it will be forwarded to the board, please.
I don't know.
I hear some talking in the background. Does somebody have a radio or something on?
I think we received it this morning. I think Victoria sent it out.
Thank you. I appreciate that.
Any further comments or questions?
I have one more question. Being that I don't think I have the smallpox vaccine, but if you, what is the correlation between having the smallpox vaccine and getting monkeypox?
It's a very good inverse correlation. So if you've been vaccinated against smallpox, you probably won't get monkeypox. If you do get it, it'll be very short-lived.
The smallpox was eradicated in, I believe, 1980. So that vaccine isn't even part of the childhood immunizations anymore. So the younger population is not vaccinated.
And I did want to share also with other reports, we'll hear more about vaccine availability and the plans for national and state, I guess, national state availability. Thank you.
Okay. Thank you.
And one more question. So is the smallpox vaccine the same as the monkeypox vaccine, or are they two different vaccines?
So there actually is not a specific monkeypox vaccine. Those two vaccines I talked about are smallpox vaccines, but the cross-reactivity is extremely high. Therefore, it's very protective against monkeypox. So until a specific one is manufactured, and they may not manufacture a specific one because these work so well, you're getting vaccinated with smallpox with very good protection against getting monkeypox.
Thank you. Good questions. Is there any further comments or questions? Okay, well, if not, we will move on then to financial report with Mr. Porter.
Gotta unmute myself. Good morning. We will be reviewing the month of June, and it's starting on page, what page is it start on?
Page 10.
Page 11 in the packet. Yes, thank you. I would like to begin with reporting on our audit. Our audit actually started at the end of May, and just we had our audit interview yesterday, our exit interview. It went really well. It was definitely a unprecedented year when we were going through that audit. We had State Fair Park activities and vaccination activities, mobile vaccination. So it was definitely a size and scope that this district has never seen before. And so there was a lot of work by Nathan and Ryan, Melissa, Sean, Lillian. They all put in, and of course Andre. They all put in hard work for that. And it's not having a good audit isn't doing anything after the end of the year, and it doesn't do it's the things that we're doing right now. It's our internal controls that we're doing right now is what results in a good audit. So getting into our financials, June 2022, we are halfway through the year. The thing with June is that we have it's a fiscal month end for some of our contracts. So we have for our BCHP program, our breast care health program, breast cancer, I'm sorry, excuse me, healthcare program. Their contract ends at the end of June, but a lot of medical billing, we won't get a lot of that medical billing until August. And so we'll have to do some back posting, so there will be a prior period adjustment for next month. But for the month of June, we had about an $18,000 gain in excess revenue, bringing our total excess to $701,000 for the year. Our budgeted revenue for the year was $20.7 million, and our through the month of June, we would expect it to be about 10.3 is what we budgeted, and our actuals are actually coming in at 6.3 million. So we're about 4 million under budget compared to revenue. And the same thing for expenditures. We had budgeted 10.5 million, and our actuals coming in at 5.5 million. At the end of last year, we budgeted that we would be at full operations right now. Thank goodness we are not. Thank goodness we are not operating the State Fair Park. Thank goodness we don't have mobile vaccination units. But last year we did budget for those things. We weren't sure how this year was going to go. And so that's the reason why we have these large differences. Any questions about that? I mean, a little bit more extra detail just for the benefit of some of the new board members this morning. And so I will try to hurry through the rest of it. I know we have more to discuss. Next page, please. Kind of speaking towards that large differences. So you can see right there, the federal money right across the top. We're about $1.1 million short for the month and 4.5 for the year. If you continue on down the page to professional services other, you'll see that jumps out quite a bit. Again, that's a direct correlation. That $4.4 million is driving our federal, and we're expecting that, and it's professional services because we were expecting to be mobile vaccination units, people working at State Fair Parks, those kind of things. This is real quick. Is there any questions about the income statement? All right, next page, please. Again, at the end of this, not much to note. We got a 701 gain in excess revenue. Any questions about this piece? Moving down into the program section, please. We've actually had a new, if you could zoom out slightly, please. We've received new funding as of year, Foundational Public Health Services, and that's what this big brown gray block is right there. 115 through 405 is Financial Public Health Services. That is almost like flexible dollars. We can use that in many different cases here, and we had a little bit slight over in that, but we can make up for that with flexible dollars. So this is the majority of our programs here. As you can see, COVID is kind of like one of the highlighted ones. If you scroll down a little bit, we are in STDs, we are say over budget. However, if you look at that section right there, you can see the majority of the programs are over budget. But if you look at them together, we're doing okay. It's just seen an uptick in STDs in Yakima. We weren't quite expecting that at the end of last year. Any questions regarding that? Next page, please. Moving into this blue section is our EH programs. We have a lot of different quarterly billing, and so things are going well in EH. They are starting to rebound in programs. So we've had some losses in our on-site, which is 540, but we're starting to break even in those programs. Any questions about programs? Next page, please. Here's our COVID income statement, all of our expenses and revenues for COVID. As you can see, that is dropped dramatically. We were, this time last year, we were spending about $1 million on COVID a month. This month is 73,000. So it's definitely starting to see a tick away from COVID response. Last slide, please. Looking at our cash flow, we had a slight uptick in May, but our downtick in cash in June, which is to be expected. We'll get another $500,000 for flexible dollars at the end of July. Sometimes that posts in August because it comes in like on July 31st at midnight. So that might post in August, kind of depending on how the treasurers post that, but we are expecting an uptick in cash here next month, if not the following month. Any questions? Okay, thank you for your time.
All right, well, thank you, sir. And for the two new members, if you, as you look through the financial report, if you see any line items that you have questions about, feel free to contact Chase. He'll give you more information on those items. There's a lot of detail in these reports, so don't be afraid to ask questions.
Yes, there's a lot of detail that I went through very, very quickly. So yes, if you have any questions, please let me know.
And Commissioner Anderson, if I could interject for just a second, I said it before the meeting, but just congratulations to Chase and the team on the clean audit. It's always nice to have a clean audit.
Oh, man.
Thank you very much.
Well done.
Thank you.
Yes.
Yeah.
Good. All right. I need to ask, is there a motion to approve the financial statement as presented?
Motion to approve the financial statement for June 2022.
I will second that.
Been moved and seconded. Any further comments or questions? Hearing none, Mr. Ibach, would you take a poll, please?
Yes, if you're in favor of the motion, please state yes. If not, please state no to approve the financials for June. Commissioner McKinney?
Yes.
Commissioner Lindy?
Yes.
Councilmember Byers?
Yes.
Dr. Atterbury?
Yes.
Councilmember Duval?
Yes.
Dr. Cleary?
Yes.
Stephanie Algren?
Yes.
Aileen Ackerman?
Yes.
Commissioner Anderson?
Yes.
9-0.
Thank you very much. Appreciate it. We will now move on to the agency reports. The Executive Director, Mr. Fresco.
Yes, thank you, Commissioner. Good morning to the board and those joining us. First, I want to thank again Ms. Ackerman and Ms. Ogren for joining us on the board, and certainly welcome to Mr. Curtis. I'm glad that Jim Curtis is on the call, considering we are talking about a fast-moving communicable disease, and we certainly want everyone in our community safe, and you'll hear more about that in the future. Also, and Ryan can go into more detail if necessary, but we did have an introduction with Ms. Ogren and Ms. Ackerman, and we'll have a more formal introduction about our process and certainly our financials. So thank you. I wanted to also recognize that we are very fortunate to have had a very clean audit. Chase and his team and all of our directors worked extremely hard on that. It's something that we began well over a year ago planning for these kinds of scenarios, but it is amazing given the unprecedented amount of money and new programs and funding sources that were really hard to manage. So I'm really grateful to the team for doing such a wonderful job. I wanted to just touch on the fact that, again, the reason that we wanted to bring to your attention the monkeypox outbreak is because we are now managing two very serious local communicable disease outbreaks that are also national and worldwide in scope. And so this is really unprecedented in terms of our work. We did have a hepatitis A outbreak at the beginning of COVID, but we find ourselves now managing two serious issues that really do affect our entire community potentially. So we want to take that seriously. We're prepared for it. We've been working as a team, and obviously we're available if you have any questions on that. I did want to share, though, that one of the benefits of this monkeypox outbreak coming now is that we have a very strong internal mechanism in terms of communication, in terms of partnership. We've been working very hard and have certainly staffed up over the last few years to be able to communicate not only to our medical partners, those in social services, but also with the community about how we maintain safety. And so we will be sharing that. And one of the things that you heard in the spotlight was that we're not just talking science, which is very complex, but we're also talking the choices that people make in a society to remain safe. So we will be doing a great deal of active communication, and we will be sharing that information with you. We continue to see high numbers in terms of transmission of COVID-19, although I am grateful, and I think we're all thankful that it's not resulting in hospitalization and death. But we have a very highly transmissible vaccine, or rather illness. And one of the things that I'm reminded is that we saw very high numbers last summer as well. I did not expect that during the hot season when people are outdoors that you'd see high transmission, but actually it was the opposite last year. And we're seeing that again now. And so we have a very, very easily transmitted communicable disease. Fortunately, it is not, again, leading to death, certainly not leading to people being ventilated, which is wonderful. But it is a concern for us, and we'll continue to communicate to the public about best safety measures. We will have a great deal more on monkeypox to share. We'll follow our normal strategy, which is to make the board aware of what's happening, certainly educate you about what we learn. This is very complex. It's certainly not something that I'm familiar with, but we will rely on the expertise of Dr. Barg and Melissa, and also the support of the Washington State Department of Health as we move forward. I did want to touch on one thing which Dr. Barg said appropriately, which is that these vaccines were created for smallpox. And smallpox is not only a worldwide concern, but it's also, in a sense, a weapon. It's a biological weapon that was always of concern strategically because it could be used to hurt people. And actually, it was in history, it was used to infect your enemy. I share this with you because the Strategic National Stockpile, which is what we commonly refer to as the holding tank for vaccines, for supplies, has a great deal of this vaccine, not because of monkeypox, but because of smallpox. So we do have vaccine available. I'm very grateful that it can be used to treat monkeypox. The process of how it gets from a strategic national stockpile or even a pharmaceutical company that may be out of the country to the strategic national stockpile, to the federal government, to states, to us, is extremely bureaucratic. So that's part of what we will be working on statewide, is how we attain the things that we need to keep people safe. That's all for me. I know that we've shared a lot. If you have any questions, I'm happy to answer them.
Thank you. Any questions for Mr. Fresco? Hearing and seeing none, we'll move on then to Dr. Barg.
I think my piece there we already did as the headliner.
Okay, that's good. Sounds good. All right, we'll move on to Operating Chief Officer Ryan.
I'm sorry, Commissioner Anderson, I couldn't get my little hand up, but I did have one
Oh, I'm
question
sorry.
for Dr. Berg, and I apologize.
Go ahead.
Dr. Berg, I know that we had reached out to the hospitals, inquiring again if they would begin to provide data about whether or not folks were being hospitalized with COVID versus because of COVID. And to Director Fresco's point, we're all very grateful that folks who are finding themselves hospitalized and positive for COVID seem to be incidentally found to be COVID positive. My main concern was with the number of children, because we still heard back from the hospital saying that they simply are not able to differentiate between with or because of. And so I wonder if you could just speak to your experience, noting it will be, anecdotal, but would you say that the children who are hospitalized in Yakima County that are showing up on our situation report, would you say that those are incidental more than likely, or that they are truly experiencing greater than national average negative and severe symptoms from COVID and having to be hospitalized because of it?
Actually, since I'm not a pediatrician, I don't get onto the pediatric floors very much. So one of the pediatricians that works in the hospital will probably be the best source for that information. Again, it will be anecdotal, but I think it would be nice to know what the trend is. Last time I was in the hospital was in June when I was doing consults, and those were my adult observations, that a lot of them were in for other reasons than COVID, but tested COVID positive for like pre-surgical events. So can't tell you about the kids though.
Yeah, well, I appreciate that. I'm wondering then, Nathan, given their inability to provide specific data, could we reach back out to them and ask that they would at least anecdotally provide data for instance, if someone tested positive because they were going to have an elective surgery, or perhaps they were admitted because they were going to go up to the 4th floor to give birth to a new member of the family. And at least as far as the children specifically, at least anecdotally, could the pediatricians on staff be able to speak to the health board as to whether or not we should be concerned about the impacts of COVID on our under 18-year-old children in Yakima County?
Commissioner McKay, I'm wondering if you don't mind, I think we have you down under new business discussing this specifically, if I'm not mistaken. Is that something you prefer to wait until we have the new business, or would you like to?
I apologize. I thought there were a couple other topics, but that's really all I had to say. So if Nathan is able to do that, that would be great, and I wouldn't need to talk about it later.
All right, thank
Yeah,
you.
I can certainly reach out to the hospitals and see anecdotally what they're seeing from their side.
All right, thank you. Any further questions or comments?
This is Dr. Cleary. I'll just refer you to a paper from Lucille Salter Packard Children's Hospital at Stanford. They analyzed the incidental versus symptomatic pediatric admissions for all children admitted over a 9-month period in 2020 through 2021. And they found 49% were incidental in children, which is significantly higher than that in adults.
Thank you, sir. Any other comments or questions? Hearing and seeing none, we'll move on then to Mr. Ibach.
All right, there's 2 items I'd like to bring to the attention of the board. The first one is that our attorney, James Elliott, and I will be working on a resolution that mirrors Yakima County Code 6.04, which is titled Membership Term Compensation Reimbursement of Expenses Related to the Board of Health. We'll work on that resolution. It'll be sent out to the board in advance, about a week in advance of the next meeting in August, so they can review it, and then we can have discussion at the August 31st meeting, and then a vote on that resolution in the September meeting. James, did you have anything else to add to that?
No, that's it. I'll be sending it out individually to each board members. It'll give you a week in advance, and then the discussion should take place solely at the August 31st meeting. Obviously, try and not be sending emails to each other related to anything. Just talk about it in the open meeting on August 30th. Then if there are suggested changes that we need to make, we will make those and make it available for a vote in September. on September 28th at that board meeting. We felt it was appropriate, especially for our new board members, not to throw this down on you right on your first meeting. So there's no need. We've got a board that's in compliance. We're still waiting on AIHC in terms of their selection of the tribal member. I don't think we've had any update on that, but that's where we're at on that process, unless there's any questions anyone has for me on that topic.
Any questions for Mr. Elliott?
Okay, and the other item that I want to bring up is that we are starting our budget planning for the year 2023. And so I just wanted to go over the schedule with you so that you're aware, and we'll continue to update the board. But on the next meeting, August 31st, we will be submitting a fee list. And so that you can review the fees that we're proposing. And then we will do a public notice for a public hearing for the September meeting. At the September meeting, there'll be a public hearing for fees and a vote on the fees. And then we'll also be presenting a draft of the budget for 2023 at that September meeting. Beginning of October, we will advertise for a public hearing for the budget. And we usually do that in the paper, social media, and the website, and at our office. And then at October meeting on October 26th, there'll be a vote of the budget. If that does not pass, we don't have a meeting in November. We combine the end of the November meeting and end of December meeting into one meeting due to the holidays, the beginning of December. And so if that budget doesn't pass in October, then there'll also be time on that December 7th meeting to also vote. So now that our audit's over, we go right into budget plan. Any questions on the budget?
Any questions or comments?
All right, that's all I have.
Thank you, sir. Hearing and seeing none. We'll move on to the Emergency Response Coordinator, Mr. Johnson.
Good morning, everybody. I have a few updates for the board this morning, one of which is, as was mentioned earlier on, we are seeing a rise in COVID cases and outbreaks throughout Yakima County. So our team is still actively responding to COVID. Also, in terms of COVID, there has been a new vaccine that has been approved. It's Novavax. It is a little bit different science behind the vaccine. It's a protein-based vaccine opposed to an mRNA vaccine, which provides a great alternative for the community who was a little hesitant on getting mRNA vaccines. That has been fully approved and we'll be working on getting distributed out to providers within the next week or so. It is a 2-dose vaccine that's approved for anyone 18 and older. The other thing is our test site that is being funded and managed and supported through UW Lab. UW is committing to continuing having a community-based test site here in Yakima through the end of the year, if not longer, depending kind of how the respiratory season goes. So that's a nice benefit to have continuing in our county for the community to get tested freely and easily. In terms of monkeypox, we are internally, as was discussed earlier, lots of communication and work internally around monkeypox. We are not activating our incident management team as of yet, but it is something we are definitely starting to coordinate internally here. We're looking at different communication plan ideas. We're looking at ways of securing and getting the vaccine and also the TPOXX antiviral. Right now, the vaccine, the state received a very limited amount of the vaccine and they pre-positioned that into a few LHJs across the state as almost a hub and spoke model. So if we need vaccine, we can reach out to DOH and they'll facilitate a transfer to get some over to us. And we do actually have some here at our location right now. The last big update I wanted to let the board know is one of the things coming out of COVID that we wanted to really capitalize on is the idea of making an investment to not only increase our emergency preparedness and response capabilities here in Yakima County, but also an investment into something that's going to make a difference in day-to-day life for our residents. So we made an investment of purchasing 13 hand washing stations. They're large industrial hand washing stations that each sink can hold up to 430 hand washes. We partnered with the State Fair Park to house these, and they're available for any community event throughout the county. So any community partner who would like to have these sinks at their events, we can coordinate with them. They can pick them up from the State Fair Park, and then they can return back there. They're very nice, and like I said, they allow us in an emergency stance to have that capability if we need to set up a large sheltering, or we're talking about these large responses in terms of Cascadia Rising and things like that. So it helps that capability. And then it also just keeps the community safer day to day by allowing more hand washing at these large events that have the community going in and out. So whether it's food trucks, livestock events, we could have ample hand washing available. So we're really excited for those and the partnership with the State Fair Park and certainly our other community partners in the future. And I think that those are the big updates from my end. Happy to take any questions.
Thank you, sir. Any questions for Mr. Johnson?
No, I just wanted to say I'm particularly happy to hear about the hand washing stations. I think that's a great investment. Thank you.
Thank you.
Thank you. All right, well, we'll move on next. Yes.
Hey, I do have a question.
Oh,
This is Councilmember Duvall. So about the hand washing stations, is there going to be any costs associated with using those for community partners?
Absolutely not. No cost associated. They were purchased and they're owned by YHD, and in a partnership will be stored at the State Fair Park. So the partner who reaches out and wants it will need to obviously transport them. They are fairly large, but they're nice because they can be skid loaded on the back of a truck. They could be put on a trailer and securely attached. So really it's up to the community partner to actually do the transportation, but other than that, no cost.
Is there like a limited amount of time that they could be borrowed? Because I'm thinking of a few ways that we could use them. I know in Toppenish we have an emergency weather shelter, and it's something I had asked for in the past because there's no running water or anything like that there. So definitely be reaching out in the future.
Yeah, absolutely. And right now there's no designated time limit as long as they're actively being used. And obviously they'll have priority with emergency preparedness and response activities. And then also the fair, since they're housing them, will have priority over them. So if they have an event going on already and they're using them, but we'll do the best we can to really accommodate our community partners and get them throughout the county.
Okay, thank you.
Thank you. Good questions. Any other questions or comments?
I do have a follow-up question, if I may.
Sure.
And that is, how are we reaching out to our community to let them know that this resource is available? Because there are so many community events, and I think it's great to make that available. I want to know, how do we get the information out?
Absolutely. So this is a new resource that we just recently got in, and we've been working on a memorandum of understanding with the State Fair Park. So in the coming weeks, we'll be reaching out and utilizing our elected officials as partners to help kind of push that out, along with YVCOG as well, to really get that out to the communities and community partners, knowing that that resource now exists and how to reach out and get that if they need.
Thank you.
Thank you. Good question.
If I can add a little, if you don't mind, Commissioner Anderson, the purchase of this was specifically for emergency preparedness and response. So the goal is to have something that maintains safety in an emergency. So that's our number one goal. But this falls in line with our strategy, which is really community resiliency. There's a tendency when we talk about disaster preparedness for something to sit in a warehouse and wait until one particular event. What we're trying to do is to incorporate this into our strategy, our goal for the community, which is to be more prepared, more safe, and things to be more available throughout our county. One of the reasons we purchased these really robust stand-up hand washing stations is they can be placed anywhere, literally. And so it's not dependent on electricity. It's not dependent on being indoors. it really is safety in all parts of our community. So it's a mobile platform, and we really, as Nathan said, have to create the infrastructure for it. But this is why we're so pleased about it, because what we want is to ensure that people throughout our county always have access to things that make them safe, but also we recognize that as a visitation county, if people coming from throughout the region and other states, we want them to be safe, and we recognize that it's a need, and we're so grateful to partner with other agencies, because again, we couldn't do this alone. Thank you.
Good, thank you. I would suggest maybe, Mr. Johnson, if you have a picture or rendering that can be sent out with some basic information to all of the board members, so we have an idea what they look like, and all of the related information on them. Appreciate that.
Absolutely, I can certainly do that. These are really nice units. They're not the like little plastic things that you see next to a honey bucket. So we're excited to have them, and I'll get some information out to the board members.
I appreciate it. Thank you. All right. Any other questions or comments for Mr. Johnson? Hearing none. We'll move on into disease control with Melissa Sixberry.
Okay, I guess I'll start with that. We are going to be interviewing next week for another public health nurse to join our team. This is going to be an addition to our team, not a replacement, as funding that was given to us by the Department of Health in response to the STD or STI outbreaks that are going on within our community. And we are also hiring for a public health specialist that we'll be interviewing next week as well. That's a replacement position for a staff member who moved on to another position with the Department of Health. And then we currently have 4 active TB patients, which is the same that we had last month, so no new additions in active TB cases over the last month. We are working on a syphilis outbreak still that's been ongoing for several months now. The Department of Health has sent over quite a few of what they call DIS or disease intervention specialists to help with that outbreak response. They go right out into the field and get people tested and get them in here for treatment. So they've invested quite a few staff to Yakima for resources on that. COVID-19, we're continuing to see an increase in our outbreaks. The cases are going up. As of last Friday, the Department of Health estimated that the ascertainment level, meaning the cases that we actually know about, is about 12%. So if you think about the cases that are being reported, there's obviously much more, but thankfully our hospitalizations are not reflecting that, and our deaths are not reflecting that either. So the strain that's currently out there, which is the B5, is not as it doesn't seem to be as severe as the Delta variant that we dealt with last fall. And then on with monkeypox, just a little bit more about what we're doing with monkeypox. We are really working in preparation instead of just a response. So we had Ben Franklin had a positive monkeypox case that led to, anytime we have a positive case, we start a contact investigation and we get vaccine into the close contacts. So Benton Franklin's case led to 3 close contacts of Yakima County residents. We quickly obtained vaccine from Benton Franklin and got those 3 individuals vaccinated, and then we continue to monitor them for 21 days and give precautions on what symptoms to look for, which is, at this point, you don't have to isolate it or quarantine. If you're a close contact, you monitor for symptoms, including fever checks twice a day. And then we are, with our current case that we just identified this morning as a confirmed case, we will start a contact investigation, and close contacts will be identified, which we already started doing that, and we'll be getting those individuals vaccinated today as well. And for those, the cases that we identify, they are given isolation instructions to isolate and stay home. And that's it for me, unless there's any questions.
Any questions? Comments?
Can I recognize Commissioner McKinney has her hand up, sir?
Yes.
Thank you.
I had a question, Melissa, that I hope you can help clarify. On our sit rep, I've been watching the graphs that, of course, we've got great breakdowns that show ages and vaccination status for people who have tested positive and who have been hospitalized. And I was noticing that for July, I believe there were 53 people who have been noted to have been hospitalized for COVID. And out of those 53, it states that only one was vaccinated. And the other thing that struck me, though, is that of that 53, I believe about nearly 40 of them were 65 and older, and 24 of them were 80 and over. So to me, it seems statistically improbable that only one of those 53 people was vaccinated. So I'm just wondering if there's information that, I know Victoria was looking into it, and the statement was that that's what the State Department of Health was providing. So I'm wondering if you have a little more insight and can explain how only one of 53 could be vaccinated, considering the age of the population.
Lillian, I think you were in direct communication with our Department of Health, correct, or Stephanie? This is on the lag of information. They have a lag on the information from the it's called WAIIS. It's where vaccine information is put in, and then it goes through Department of Health and our through the Department of Health website. And our epidemiologist, Dr. Barrios, was going to be reaching out to confirm numbers, but that was the information that we had from the Department of Health's website.
So I guess to a more direct question, has the term vaccinated, fully vaccinated, perhaps the definition has changed? Has the Department of Health changed the definition to include that you would have to provide proof of perhaps receiving boosters?
No.
So the definition of vaccinated still remains 2 doses or 1 if you received the Johnson & Johnson. And so it seems then that your guess is that this is just a lag in the information.
Yes, so I'll reach out to Dr. Barrios, our epidemiologist, and see if she was able to confirm any information on that and follow up with you.
All right.
Dr. Bard? Oh, I'm sorry, excuse me. You were okay. Dr. Bard?
We're good. Yeah, just to further clarify, fully vaccinated means receiving 2 doses of the mRNA vaccine or 1 of the Johnson & Johnson. Johnson & Johnson is now not offered. Now, up to date means that you've gotten your boosters. So that's the differentiation. And if someone's fully vaccinated, they haven't gotten the boosters. If they haven't gotten the boosters, they're not as well protected against the Omicron strains and their follow-up variants. The other thing about the age, in general, we're doing pretty good with over 65. That's kind of the highest area, that's the highest proportion of vaccinated people in the county, and has been for many months. And I think what might be going on is the unvaccinated people are being selected for, as they would be with any other vaccine preventable disease. So the concentration of unvaccinated may look to be bigger, but if you look at the whole population, I think it's representing folks that don't have any protection against the virus at all, as opposed to the larger group that has some or a lot of vaccination. So maybe self-selecting.
And our epidemiologist is actually watching this on Facebook Live, so she's responding to me as we speak, and she's saying that they've identified they have created a new way of identifying linkages between the 2 systems, and that seems to be the problem. And she said she's still waiting for a response from the Washington Disease Reporting System, but it would appear that information is not complete, so not quite accurate information in there.
I thank you for that. And Dr. Park, to your point that you just made, though, naturally acquired immunity, though, does give you great protection. And I would say that based on the numbers that we're seeing, I'm wondering, it seems to me that it would be a high number, and I don't know what the estimates are now, but I know that back in March, there was an estimate that over 70% of children 18 and under in the United States at that time had already acquired COVID. So do we have any idea at this point of estimations of how much of the United States population has now had COVID, whether vaccinated or not, and now has that naturally acquired immunity as well as potentially vaccinated immunity?
They've changed the way they're talking about it. It's not the number of people vaccinated, but the number of people who haven't gotten COVID. And that number is very small after the current Omicrons. And after BA.5, I think in a couple of months, there may almost be nobody that hasn't had vaccine or natural immunity or both.
Thank you, Dr. Berg.
Any further comments, Commissioner? Okay, thank you. All right, well, we'll move on then to environmental health with Mr. McGee.
Good morning, everybody. Just a couple things I want to highlight for environmental health this morning. Our land development programs continue to be very busy, as well as our water recreation program. As most of our seasonal pools are now open, so we are out in the field inspecting those. Given the current heat wave that we are experiencing, until this heat wave breaks, we're having staff try to concentrate their outdoor field work in the first half of the day. This is for their safety, for our community members and stakeholders' safety. If they do have to do inspections in the latter part of the day, we're asking that they spend a little time in the air conditioning of the vehicle to cool off, so they don't suffer from any heat exhaustion or anything like that. Lots of water, sunscreen. So we're taking the heat wave into account right now, as we do every time we experience one. Another quick thing I want to highlight is we do have, a lot of the staff at EH have come on in the last year or so. However, we have really emphasized a lot of cross training across all programs, and I'm really happy to mention that we have more staff trained in more programs than we've had in recent years, and almost everybody is working independently across all of our environmental health programs, which is allowing us to keep up really well on the demanding fieldwork list that we have for our land development, which in some years past, it's been a week or two out for us to get out to an inspection, and now we're typically getting to our inspections within the work week or 5 business days. So really happy about that. Everything's in land development is operating efficiently, and as most of you know, for a lot of these contractors and stuff, time is money. So we take pride in not keeping them waiting and forcing them to keep equipment at a job site when it's unnecessary. So that's a lot of what's going on in environmental health, and I'm happy to take any questions if there are any.
Commissioner McKinney.
I just wanted to say thank you, Ashan, to you and your team. The industry is noticing and very grateful and acceptable to see, and I just wanted to pass on that I'm hearing good things and very grateful to see that and hear that.
Thank you.
Yes, thank you. I guess just a quick addition. We did revamp a lot of our septic clearance sign-offs and approvals in partnership with Yakima County Public Services, as we do a lot of work with each other on getting building permits pushed through and boundary line adjustments and subdivisions. And we're noticing a big difference in efficiency with the updated process that we did back in late winter, early spring. So we're really happy that it's working out really well. And I think it's made it easier on our staff and public services staff. So.
Thank you. Any further comments or questions for Mr. McGee? Hearing and seeing none, we will move on now to public health partnership with Lillian Bravo.
Thank you. So as referenced earlier, we have successfully closed out the fiscal year for the breast, cervical, and colon health program. So this program provides breast and cervical cancer screening for uninsured and underinsured women. The Yakima Health District administers this for across 7 counties in Eastern Washington. So just a little bit of background on some of the programs for our new board members. But specifically, I wanted to mention and call out that we did serve 1,174 women over the last year, and we did, fortunately, were able to identify cancer in women, 8 women. 4 we identified cervical cancer and 4 breast cancer diagnoses. And so we were able to successfully transition them into cancer treatment through this program. So again, we are very happy that we're able to provide these services to these underinsured and uninsured women, and look forward to providing even more services in the next year. In addition to that, the Yakima Health District also administers the county's developmental disabilities program. And as part of this program, a few years ago, the Yakima Health District worked with Selah Middle School to pilot a program called Start Now. This is a hands-on interactive workshop for middle and high school age students, as well as their families. And it helps them to begin thinking and preparing for future community employment and life. So we were able to start that up in Selah Middle School a few years ago, but due to the pandemic, we weren't able to expand. And I'm happy to report back that now, given the changes, we have been able to train staff over at Wapato Middle School and are looking forward to continuing into the Lower Valley. So I'm happy, I'll be reporting with updates on that once we have more available, but we're starting to expand in this very important program. And then next month, we will launch the second portion of our overdose awareness campaign to promote education around overdoses and naloxone. As we talked about last month, we focused on describing the issue related to overdoses specifically in our community. And in this upcoming month, leading up to Overdose Awareness Day on August 31st, we will be focusing more on how individuals can access naloxone as well as how to safely utilize it. So that'll be the second portion of that messaging. That'll start next week and again, go for 4 weeks and conclude on Overdose Awareness Day, which is on August 31st. And then finally, we are also supporting other communications related to COVID-19, moving forward, of course, with monkeypox, and then sharing relevant resources and information related to heat-related illness, given the fact that we're all experiencing this triple-digit weather. So those are the updates that I have for you all. I welcome any questions.
Thank you. Any questions for Lillian? Comments?
Thank you.
Thank you. Hearing and seeing none, we'll move on then to unfinished business. Update on the letter to Governor Inslee regarding Proclamation 21-14.3 and Commissioner McKinney.
Thank you. I had, I think we'd asked, or I had asked Clerk of the Board, Julie Lawrence, to provide a copy of the draft letter to Victoria. And had Victoria, were you able to send that letter out to everyone?
Yeah, that was sent to the board.
Okay, are you able to pull it up?
Yeah, just give us a few minutes.
Perfect. That way we can all look at it. So this letter was just, we had voted in approval as a board to send a letter to Governor Inslee to rescind his proclamation, specifically Proclamation 21-14.5, which requires vaccination for COVID-19 to be employed in certain areas or contractors. And it also notes that a worker in the state of Washington under this proclamation is inclusive of anyone who volunteers their time at a health facility and also inside of classrooms, whether or not they be on school campuses, public or private. You know, we've seen right now, and what the topic of conversation has been in this meeting is that COVID vaccine does not prevent acquisition of the virus. At this point, we have a high propensity of both people having contracted COVID, whether vaccinated or not, and having both vaccine immunity and naturally acquired immunity. And it seems that clear that it is unnecessary to require a COVID vaccine at this point as a means for volunteering or for employment. So it is certainly high time that it be rescinded. It's reached its time limit, and we hope that in doing so, I think was the conversation our last meeting, that encouraging Governor Inslee to rescind it is something that others will join in and simply say we need to move on with our lives now. So I hope you've each had a chance to review it. I know that Mr. Elliott has noted that if there's any edits, that it certainly would be appropriate to comment on any edits that you would suggest at this time, and that's I welcome discussion.
Any comments or discussion on the letter?
I had a couple recommendations or suggestions. So well done on the letter. I just had the suggestion on the 4th bullet point, maybe providing a footnote of what data you are referring to. Be interested in looking that over. Maybe it could help drive your point. And then in the last sentence where it says, thankfully, it is apparent that COVID-19 is longer the threat to our residents, hospital system, or emergency management response capabilities that it once was. My recommendation would be to change it to thankfully it is our opinion that COVID-19 is no longer. Just changing that just because I don't think it's apparent, it's more of your opinion. Those are my my two suggestions.
Thank you. To address the first one, Nyla, the CDC data was actually, we reviewed during a health board meeting. It was actually an our report that the CDC had actually posted on their own website. If you recall, it showed that those with naturally acquired immunity were less likely to end up hospitalized and or pass away from COVID than those who were vaccinated. We did review that in the health board meeting. I want to say it was earlier this year or late last year. As to the last suggestion, I'm not inclined to say opinion. I think it is a letter, but of course it's for the rest of the board to decide.
Thank you. Stephanie.
So as a new board member, I wasn't on the meeting last month to approve a letter. And I just want to state that I am a state worker through my employment at Yakima Valley College. And I am for the vaccine mandate as a state worker. And I am representing as a community stakeholder my position on the board. And most of my colleagues at Yakima Valley College are for vaccination. I feel that the COVID vaccination reduces my chances of obtaining COVID. And if I do obtain COVID, can reduce my symptomatic days. And this allows me to work. And I feel an obligation to work for my students and for all citizens of Yakima County as a state worker. So I am against the letter. I also have on that fourth bullet point as well, that I don't think that the medications to reduce symptoms are readily available to all citizens of Yakima County. There's many citizens of Yakima County who have issues trying to find a primary care provider. And if they do have a primary care provider, to get treatment, to get in to be seen in a timely manner is very, very difficult in this county. So, and Lillian had just brought, the number of people uninsured and underinsured with the cancer prevention programs. Well, there's that many or more that would not have insurance to pay for these medications.
Thank you. Any further comments or questions?
This is Dr. Clary. Yeah, I have a couple of problems with the letter. The second bullet point I would consider false. And if you believed it was true, then you need to look at your fourth bullet point, which if you stated that the vaccine is not effective, you then state that natural immunity is as effective as something that's not effective. So that just doesn't flow well, but it's honestly not the truth. The vaccine has been extremely effective in reducing mortality and morbidity. The other issue is that I don't think there's any intention to rescind this because it impacts a lot of state workers, other workers that for whom there are other issues in their use of the vaccine, certainly among healthcare workers and healthcare facilities. Almost all healthcare organizations, the Washington State Hospital Administrators, the Medical Association, the Nurses Association, are all in favor of continued mandates. So if this is really related to increasing employment, a lot of large organizations and even small ones will not be replacing their workers with unvaccinated for a liability issue. And also they have not lost many of their workers because of the vaccine issue. I think Governor Inslee has indicated by also making an executive order that the vaccine is required for other workers and that was just this month, that's his intention to continue vaccine mandates for quite a while.
Thank you, sir. Any further comments or questions?
Aileen Ackerman has her hand up, Mr. Anderson.
All right. Aileen.
I also, being new, wasn't involved in the last meeting, but I appreciate Amanda's time on this and intent. I do agree with her intent on this. And I think if the vaccines in fact do help mitigate the disease and the transmission, then there shouldn't be a necessity for a mandate. You know, the people that want the vaccine can get the vaccine and be protected, but it should be a personal choice still. And I'm just wondering if there's been any research done or looking into what our law says based on the Constitution and in handling this, because neither the state or the federal Constitution gives any emergency powers to the executive branch. So there might be a different approach that can be taken in dealing with this issue.
You. Any further comments or questions?
Yeah, if I could interject really quickly, Commissioner Anderson. I think when we're talking about mandates, and Dr. Cleary was referencing the healthcare industry, and I can certainly see from a healthcare industry perspective that my thought would be is if the state did away with the mandate, hospitals and healthcare facilities could still keep that requirement in place for their facilities, and there's some valid reasons to do so for those circumstances because they're the ones that are really on the front line with this and other diseases.
Thank you. Any further comments or questions? Hearing none or seeing none?
Oh, I've got my hand raised, sorry.
Oh, I'm sorry. Go ahead.
I would say too of note, one of the largest differences between the mandate from Governor Inslee compared to other governors is that there was not a test out ability. So we have folks who are required, if unvaccinated, and they received an exemption, to continue testing, while people who were vaccinated are not required. And as we can see based off of the numbers, it doesn't scratch the common sense sniff test. We're having people go through more intrusive and sometimes at their own cost, more costly requirements to even go to their job simply because they're unvaccinated for COVID, when they might have already been able to show that they had had COVID. And certainly if you're vaccinated, you can certainly still get COVID and spread COVID. So the difference between an unvaccinated and vaccinated person for COVID, as far as the intent, which was to stop the spread or slow the spread, that we have to go through what the intent is. And if the intent is to keep people from spreading COVID, the vaccines at this point have not done that, or at least it slowed it down. But we know now that if you have not yet acquired COVID, to Dr. Barg's point earlier, you will soon likely get COVID. And the vaccine is not going to keep you from catching it, and it's not going to keep you from spreading it. And that is the intent of this mandate. And so to Dayleen's point, it should be a choice. And at this point, forcing someone to get vaccinated for something they likely have already had is not going to minimize in a measurable way their opportunity to catch COVID and spread COVID at the workplace, which was supposed to be the intent of this proclamation and this mandate.
Thank you, Commissioner. Any further comments or questions?
Just one, Commissioner Anderson. That is, anybody who works in healthcare, myself included, can see the shortage of workers that are on the front lines right now. And I think that any amount of workers that are being prevented from coming back due to their vaccination status is a harm to the community at whole. I think that if somebody has acquired natural immunity and did not choose to get vaccinated, and they're a healthcare worker such as a nurse or a nurse tech or something like this, those people would be very useful to the healthcare system right now. Now, to Dr. Cleary's point about whether or not the healthcare system would actually hire them or not, that's an employer choice. And obviously they've made their own statements about what they choose to do. But I think that the proclamation is mandating their choice rather than leaving it up to their own free market or the need of the community as a whole. And that'd be my comment.
Thank you, sir.
Commissioner Anderson. Oh, I'm sorry. After you, Councilmember Byers.
Thank you, Mr. Fusco. I would agree with Dr. Atterbury in this. I think that it's an employer decision right now what they want to happen in their workplace, but I believe that we have worked with this particular issue in our community, in our state, and our nation for a long time. And Dr. Cleary, to your point, I believe that if people haven't had it, they're very likely going to get it. And, it's kind of been saturated, across the board. And I think that looking at both vaccines and natural immunity, we see enough in place to have people just fully return to the workforce. We are a shortage of workers in many, many areas, a health field being one of them. And I think that we need to release a mandate that would prevent people from going back to work.
Thank you. Any further comments or questions?
Yes, Commissioner Anderson. Oh, after Ms. Ackerman.
Okay, thank you. I'm not seeing the full board at all at once, so I'm
understood.
Scrolling back and forth here. Go ahead.
Yeah, I just had a question on what tests are being used. Is it still mainly the PCR? And if so, what is the cycle threshold that it's being run at? Does anybody
for that question
know that?
I can answer that. So probably the biggest use of the test is with the home test, and it's not perfect. Positive is almost always a positive. A negative is not always a negative. That's one of the problems. And you do need to repeat the test to make sure if it turns out negative, but you have symptoms, it should be repeated. And there's a situation where we can't be sure what's going on. If you're going to go in the hospital and have a procedure done, the PCR test is being done. And they don't report out. I don't know, Daleen, if you're referring to cycle time for the PCR cycle, but they don't report that data. So, but a positive is a positive from a PCR.
Well, the history of the test is that it really wasn't intended for diagnostics, is my understanding, but that how many cycles it's run at is exponential and of great importance in the accuracy of the test.
Yeah, actually, it's the other way around. The test is diagnostic, but it's not a proof of cure.
So is there any way to find out what the cycle threshold is that they're running it at?
Yeah, it depends on the machine. The machine at Memorial, for instance, does not report out the cycle number.
Thank you. Any further? Mr. Elliott, you had your hand up at one time.
I did, Commissioner Anderson. I do see that both Commissioner Lindy and Dr. Cleary had their hands up, so I was going to defer to them, but I do have a question from a procedural standpoint about this letter. So I'm happy to wait till after they do it, but ask my question after that.
Okay, thank you. Commissioner Lindy.
Well, I guess I would just say as just an overall sense of this, I mean, we do have, it sounds like we have some a little bit of variance of opinion versus or, regarding the verbiage of the letter. But for me, the overall, the overarching thing for me is that we have so many industries and businesses through the state. We've got an employee shortage, and it seems like, you know, maybe there are some details that this letter can't necessarily sort out, but it seems to be that there ought to be a way to have more people that, for example, that retired or not eligible for certain positions due to the vaccine mandate, to give, you know, some test out or workaround options so that we can put them to work for our mutual benefit. To me, that's issue number one here.
Thank you. Dr. Cleary.
Oh, I just want to point out that we're talking about businesses hiring, but this is restricted to state workers and school volunteers. So it's not just every business hiring people back. This is just state workers.
You know, and I would just respond quickly. You're correct, but nobody hires in a vacuum. And when you have, you know, impacts on one industry, these things, there's a ripple effect into other industries as well.
It also does apply to anyone who wants to contract for state projects. And again, it impacts people who are volunteering, such as those who want to volunteer in a health setting, as well as in schools.
Well, the health setting is completely different, and that's not something this is going to affect. But do you have any statistics on how many people have been lost strictly due to the vaccine mandate? Because in healthcare, it was only 2%.
I would just hesitate when you say just 2%, that's 2% people who either lost their livelihood over this, or were not given the ability to volunteer their time to help their community. So to say just 2% seems very dismissive to me. And if the intent was to have people get a vaccine that was supposed to protect the people around them, whether they were working or volunteering, the vaccine isn't doing that. So we're requiring something that doesn't do now in present day time with the current strains what it was said to have done when this proclamation originally was enacted by our governor.
Commissioner Lindy.
You know, I would just add that, and of course, this is going to be anecdotal, but we've seen headlines recently of our local hospitals through the state of the crisis mode they're in. And part of this is due to the fact, in what I've seen, is that they're having to hire more locums and travel nurses, which have become extremely expensive and added a lot to the, well, actually subtracted a lot from the bottom lines of a lot of local hospitals and healthcare entities.
Thank you. Any further comments or questions? Ms. Byers.
I know I'm muted again, sorry. So my experience in the hospital earlier this year, just as a personal anecdote, was that probably 50% of the nurses who worked with me were travel nurses.
Thank you. Dr. Bart.
I just want to comment regarding the vaccine efficacy. We know what the vaccine does now, but we do not know what the vaccine will do in 1 month or 6 months. These strains of coronavirus are constantly mutating. We've been lucky for the past 6 months. It could go the other way. The strains could get more virulent, and vaccine protection may become more important. We just don't know. So maybe being vaccinated when it's not totally necessary in some let's say in some scenes like now, may not be true in the future.
Thank you. All right. Any further comments or questions?
Commissioner Anderson, I had a comment, but I'd like to defer to James, who I think is still waiting to mention something.
Yeah.
Yeah, I just wanted to check in. So this is a letter that's dated July 18th from the Board of County Commissioners. So I guess my first question is this a letter that the county commissioners have already sent out?
So we separately, to your question, Mr. Elliott, we separately voted as the commissioners board to send a letter. And this is just was a draft that I had proposed that this health board approve the same letter or consider the same letter. It seemed that the intent was the same, so it didn't need to be different. But I can't speak to whether or not the letter was sent out by our clerk or not. I don't know that yet, but it certainly wasn't the intent to have the board, the health board, sign on to this letter. This was merely provided as an example of the content.
And that's what I wanted to clarify. If the county commissioners had already approved this letter being sent out by the county commissioners, obviously one thing, I just want to make sure our board wasn't giving the county commissioners sort of approval or agreement related to your letter. So if it's already been agreed by the county commissioners that this letter has been sent out, that's one thing. The idea was this was a draft then that this board would be discussing as this board sending out a separate letter from the county commissioners. I just want to make sure we are on the same page on that.
Yeah, James, this, to be fully accurate, this probably should say draft across it. Because it hasn't been sent out by the commissioners.
Thank you. Any further questions or comments, Mr. Fresco?
Yes, thank you. I just wanted to mention for the purposes of the entire board, I recognize that we've had a robust conversation again, but I did want to share that the issue of emergency powers that rest with the governor, not just with the specific governor, but the governor who was elected, that was settled law that's been put in place by the state legislature. And also emergency powers are very much a state privilege that does not rest with the federal government. It rests with the state. So I share that with you, that we may have people who disagree with that process, but that was a process that was vetted. So that's settled law. I also wanted to mention that while there may be opinions about the efficacy currently of vaccines, I think it's concerning to say that vaccines don't matter currently. I think that vaccines continue to keep people from getting COVID. And also there are many, many people who have a different impact once they have COVID. So while again, I'm grateful, I think we can all say that we're grateful that people are not on ventilators, hospitalized for many weeks or months and dying. The reality is that some people who are home are suffering tremendously, and we don't know what the impacts long-term to their health is overall. So I think that it's necessary to point out that when you do have a vaccination, that you are safer once you have that vaccination. I recognize that natural immunity has a place, but it was hard earned before. We've lost 1 million folks. And again, as Dr. Barr pointed out, what we're looking to do is make certain that people are safe regardless of the threat. Thank you.
Thank you. Now, we've had a lot of discussion about this letter in particular. We were having a discussion, and is there a decision that the board wants to make or consider? Commissioner McKinney.
I just wanted to briefly speak to Director Fresco's point. That same MMWR report that we reviewed at our previous health board meeting actually also showed that if you had acquired COVID and then you went and got vaccinated for COVID, it did not provide you any additional protection when compared to people who caught COVID a second time after naturally acquiring it. In fact, people who had caught COVID and acquired natural immunity were better off at not going to the hospital than folks who then subsequently got the vaccine after acquiring COVID. And if you want, we can review that data from that report again.
Thank you. Any further comments or questions? Are we at a position here where the board wants to make a decision on this letter, or do we want to? What's the board's pleasure?
This is Dr. Cleary. I think this is the prerogative of the county commissioners to write a letter that represents their opinion, but I think the Board of Health has its own diverse opinions, and we should probably let this just be sent by the county commissioners if they agree with it.
Thank you. Is that the thoughts of the board?
I agree with Dr. Clary.
I would actually argue that we should send the letter, and I support what it says. So I guess there's a difference of an opinion. I would suggest a vote, and then the majority would decide.
I would concur.
Valerie, are you making a motion?
Yeah, I make a motion to send this letter as written, unless there's any typographical errors that need to be corrected.
Is there a second?
I'll second the motion.
Been moved and seconded. Any further discussion?
I would just again recommend some of my suggestions and take into consideration the conversation that we had today and differing views of opinions today. And just to remind this board that even though there was a specific intent for this proclamation as stated before, this board also has a responsibility to uphold the mission of the Yakima Health District and goes against it.
Thank you. Any further comments or discussion? Questions? Mr. Ibach, would you take a poll, please?
Excuse me, Mr. Anderson. Yeah,
Go
I'm
ahead.
sorry. I didn't get my hand up soon enough. Mr. Vol, can you share with us again what your two concerns were about the letter as written?
Yeah, so the fourth bullet point, I was recommending that we just make a footnote to reference the article from the CDC and that was discussed at our previous meeting. I do remember that it was discussed. I don't think it'd be very difficult to provide just a reference to that. And then at the end, I would just like to change the word apparent to opinion, because this would be the board's opinion. This is nothing, as it has been proven in today's conversations, that this would be solely opinion.
Thank you, Mr. Ball. And I would agree with you on those 2 points. And I'm wondering if Dr. Atterbury, if you would be interested in amending your motion to include those.
Yeah, I'm happy to add the friendly amendment to change the wording for opinion, I guess, for the final sentence, and then to quote the MMWR cited report that she draws the CDC reflects statement in bullet point number 4 on.
Okay, and the second,
I would agree with that and would second the approval of friendly amendment.
the first and second has made a friendly amendment to the first motion. Mr. Ibach, would you conduct a poll, please?
Yes, so what we are voting on is the amendment to the original motion, which is to make those two changes. If you're in favor, please state yes. If not, please state no. Commissioner McKinney,
Yes.
Commissioner Lindy,
Yes.
Councilmember Byers,
Yes.
Dr. Atterbury,
Yes.
Councilmember Duval,
Yes.
Dr. Cleary,
No.
Ms. Algren.
I'm a little confused. So I'm just voting on changes in the wording and there'll be a second vote about actually sending the letter?
Yes.
Yes, if I may, following Robert's Rule of Order, we have to, the board is making a vote on the amendment, and then the actual vote will be taken on whether the letter is sent. Am I saying that correctly, Ryan?
Yes, that is correct.
Thank you.
No.
Ms. Ackerman
Yes.
and Commissioner Anderson.
Yes.
Okay, so the vote is 7-2 on the amendment.
Is there a motion on the original motion?
So we have had a motion and a second, and we've had discussion. If we're ready to move on to the vote on whether to send a letter with those two changes, then we can move on to the vote.
would you like to conduct a poll, please?
Yes. So if you're in favor of the original motion that has been amended to change those two items, please state yes. If not, please state no. Commissioner McKinney,
Yes.
Commissioner Lindy,
Yes.
Councilmember Byers,
Yes.
Dr. Atterbury,
Yes.
Councilmember Duval,
No.
Dr. Clary,
No.
Ms. Algren,
No.
Ms. Ackerman,
Yes.
and Commissioner Anderson.
Yes,
So the vote is 6-3.
thank you much. All right.
Commissioner Anderson, if I may, just a point of clarification again for new board members, this is something that is coming from the Board of Health, not the Yakima Health District. So that is a distinction that we make, that the board has the privilege to send information certainly through vote, but that differs from the Yakima Health District's position on these issues. Thank you.
Thank you. Any further comments or questions?
I just want to thank Mr. Fresco for making that distinction known to our new board members. I think that's helpful.
Yes, thank you. All right, well, with that, we will move on now to the update letter to the state legislature regarding a reversal on drug possession laws by Council Lady Byers.
Thank you. So at our last discussion, we got a report at our last meeting. Actually, we got a report on the drug use and overdose in our community, and it's really quite alarming in terms of the numbers. And I've also heard Coroner Jim Curtis address different groups on this matter as well. And, you know, what great concern it is that we have as many overdoses as we do in our community. We're higher than the state level on both opioids and any type of drug overdose. So that's the purpose of the letter, is to draw this to the attention of our legislators. And the letter has an emotional appeal to it, which is generally how I approach those kinds of things. If it reads that way, it's because it is that way. When I give testimony to the legislature, I really try to hit at the heartstrings of what's really going on in our community. So I assume you've all had the opportunity to read the letter. And I want to thank Commissioner Lindy and Commissioner McKinney, and also Mr. Ibach for helping me finalize the wordage on the letter to make it presented as it is. So if anybody has any questions about that, I'd be happy to answer them. If not, I'm just open to making a vote.
I was wondering if we should put it or display it on the screen for everybody.
Oh, I'm sorry. Did we not?
No.
I have a copy in front of me because I can't read it off the screen. So
it's all good.
So again, I wasn't part of the last meeting to vote to do this. However, my input is, I appreciate the opportunity to investigate and learn about the Washington State Supreme Court versus Blake decision and the subsequent passing of Senate Bill 5476, which allows referral to drug treatment versus conviction for a first or second drug possession charge. A third possession charge is a misdemeanor charge versus a felony charge. This type of legislation has been the trend over the past 10 years in Washington State, as well as almost every state in the nation. Jail time alone does not force a person off drugs long-term. Research from the pewtrust.org organization, an independent nonprofit organization engaged in global research, has shown no statistically significant relationship between drug imprisonment and lower rates of self-reported drug use, drug arrests, and overdose death. I feel the position of the Yakima Health District Board should be advocating for approaches for drug treatment for drug offenders in Yakima County, such as all sorts of different public health measures trying to get people off of those drugs. So I'm not in support of this letter.
Thank you. Commissioner McKinney.
Yes, well, I'm in strong support of the letter. I can say that our law enforcement has found this particularly discouraging in their ability to try to engage, tracking the offense. They don't have the ability to engage with people and track how many times they've encountered someone. And unfortunately, with other laws in the state of Washington, it has made it incredibly difficult for them to follow up and get these folks into the care and treatment that they need. I would concur completely that treatment is the answer. And in fact, I would just like to share that I am currently at the National Drug Court Professional Conference. I have been learning quite a bit. What I will say is that when folks within the system who are running the gamut from judges, attorneys, both defense and prosecuting attorneys, people are treatment providers here, you name it, all up and down. When someone raises their hand and speaks and says they're from Oregon and Washington, there is a gasp across the room. And I would concur with your statement, Ms. Algren, that the trend has certainly shown that the United States of America has a troubling trend. And as we've become more soft on encounters for drug abuse, these people are not getting into treatment, and that is where we need to get them. And sometimes encountering the law is the way to get people into treatment. So I'm in strong support of your letter, Councilwoman Byers, and I do appreciate you taking the time to write it.
Commissioner Lindy.
Yes, I'm also very much in support of this letter, and I have to add that, yes, we do want to get people into treatment, but what I've heard when I've spoken to local law enforcement and those people that work at our homeless shelters who are on the front line, that, you know, the drug court, we've seen some great things happen through vehicles like our local drug court, but by July of 2023, if the law stands as it is now written, there will be, you know, as it now stands, yeah, the first time you're sent to treatment and the third time it's a criminal offense. That will all, the criminal offense portion of that will all go away, and thereby, from what I'm hearing from those people that have those encounters here, law enforcement and shelters, like I said, that you're taking away a tool or a hammer, if you will, that actually helps people to say, maybe I need to make a different choice. Maybe I need to look for some help because I'm not going in a good direction by myself. So that's why I believe we need to make this change so that we keep law enforcement options, criminal options as a tool. I mean, that's how people get into drug court right now, is that there is something that says, well, you can go to jail, or you can bypass that if you're willing to go through the drug court program and let us help you get off of, overcome this addiction. So yes, I'm very much in support of this.
Thank you, sir. Council Byers.
Yes, thank you. And thank you, all of you, for voicing your ideas and opinions. And I will say that I am all for treatment. I have, in my professional career, worked with many, many people and families involved in substance abuse. And I think that the drug court is a great option. I've seen it at work, and I've seen it work well, and I think we need to expand the program. My concern is taking away the tools, as Commissioner Lundy said, that law enforcement has to bring a person to that point where they actually, are mandated for some kind of help or treatment. And it's not only the individuals, who are using substances right now, but it's also their families. Drug court and mandating things in that direction provides a resource for the families who have family members who are addicted to drugs, and also for our community. Our community suffers as a whole when we have businesses and community events where, there can be somebody sitting there openly using drugs, where, there can be paraphernalia around, biohazardous material because of the use of drugs in the community. I did a ride along just this week with Sergeant Richie Fowler, the Yakima Police Department. It's not the first one I've taken with him. And about 3 people were under their hoodies using drugs as we go by. So, there really has to be, and this is openly out in the community in different places, there really has to be some kind of tool in the hands of law enforcement to direct people, not only for their own sake, but for the sake of the community into treatment. So that's my position.
Thank you. Dr. Cleary.
So I just want to say that I really appreciate Ms. Algren's input. I'm not in favor of legalizing drugs, but I really think that our letters are often just little tantrums sent to the governor or the legislature with no no good input. We're really not providing our suggestions and intelligent discourse on a topic. We're just making a small demand. This mentions courts, and everyone who's made comments states how much they are in favor of treatment, but perhaps this letter ought to be about how we would change the law, how we would employ these drug courts, and give some actual detail for the legislators to consider. You know, one of the problems with the Oregon law was it was just a crazy idea that violators would be given a phone number and be expected to pursue reform on their own. Of course, none of them did that. So I think if we want the law to be changed, it would be a better approach rather than just merely stricken, because that accomplishes nothing. So I would suggest that this letter be revamped with everyone's suggestions on actually how to achieve the end of drug treatment and drug reform.
So Dr. Clary, let me state that this is not a tantrum. This is something that I have worked with families in the community for years. And I am very aware of the negative effects on families and our community from the drug use. And so I just want to state my personal opinion on that it's not a tantrum. This is something I have seen devastate families and other places in our community for years. So I'm happy to look at reform.
We're all in agreement on that, but this is about how you educate legislators who don't know what to put into legislation. This is our opportunity to actually provide them with information and direction.
I don't disagree with that, although talking to our legislators personally on a personal level, a great deal, they are all very aware. They're all very aware of that, but I'd be happy to revamp the letter and verbalize some of that with input from other people.
Thank you. Ms. Duval.
You. I can't let this conversation go without also saying that there's well-known thing that there's racial disparity in drug arrests. And if you are going to revise the letter, I think we do need to address that people of color and minorities are arrested at a higher rate and are sent to jail and prison a lot more. And I think that also needs to be addressed in your letter.
Thank you. Dr. Atterbury.
Well, I think we've all hit on the scourge of problems that our society faces from drug use, drug addiction. My concern about laws like what Oregon passed and what Washington is considering passing, I believe Seattle, some parts of Seattle have already done so, is that we send mixed messages when we say we're going to decriminalize the use of hard narcotics. That is the wrong message to be sending. I mean, we need to be consistent in messaging. Now, I do agree with the comments made, Dr. Cleary, especially in stating that it's really hard to institute behavior change in people that aren't looking for behavior change. And anybody who is known an addict knows that at the time of their addiction, in the middle of their addiction, they're really not making great choices about their health care, choices about anything. So I think it's silly to think that we're going to give them a phone number, they're going to call it, and they're going to suddenly want to get off drugs, while they're in the heroin line. That's ridiculous. What we need to do instead, I think, is be consistent with the application of best practices and what forms of rehab are effective and what forms of rehab are not. I'd be careful about criminalizing behavior for the sheer sake of the mention of, we have lots of data on racial discrimination and disproportionate application of the law in different racial groups. So we need to be sensitive about that. Police are more present in minority communities and there are more arrests made in minority communities. Those are both facts. Those aren't my opinion. With that said, the behavior across all races needs to improve. And I think it is going to come through solely education about how terrible this is for you. I mean, we make campaigns for all sorts of things. I think, for instance, the anti-nicotine campaigns over the last 10 years have been very demonstrative of the fact that you can drive down behavior when you just grossly saturate the airwaves with messaging that suggests this is terrible. So I am all for not legalizing narcotics. And at the same time, I'd be very careful about criminalizing behavior as it applies to healthcare, because that's a dangerous precedent to set. And really, it doesn't do any good to throw them in jail. You just make a drug addict in jail versus a drug addict out of jail. It doesn't make any difference. So I would be all for wording this letter in such a way to where we can focus on what are the best practices and how do we get that message out. Thanks.
Thank you. Commissioner
Dr. Oh, I'm sorry, go ahead.
Oh, sorry. And I guess I would just say that, in my opinion, I look at this letter really as a starting a conversation with them, to be honest. I mean, I'll go with the sense of the board here, but I think it would be a very long and detailed process to actually, put a document in place that explains all the options. I think that's really a conversation that happens at a later point with other input besides just ours to figure out what kind of legislation is most appropriate. I think we're trying to make a statement and get the legislators' attention to say the direction you're going in is not a good one, and we'd like to reverse course. The details can be worked out as we have further conversations. Thank you.
Thank you. Commissioner McKinney.
Yes, I was had the same sentiment that Commissioner Lindy just stated, that this is the attempt here is to say this isn't working. We need to do something else. We need to encourage our legislators to go back to the table. And I would say too, one of the themes here at this conference specifically is that legislators across the United States are not talking to people who are treatment providers to find out what they think, because they're the ones who are providing treatment to these folks and would understand best, how to really engage them in a way that's going to give them the greatest chance for success. So I'm in support of the letter as drafted.
Thank you.
Now, may I speak at this point, Commissioner Anderson?
Yes.
So I thank you, Commissioner Lillian, because your point is well taken. It's my point. It's getting the attention of the legislators. We can change a little bit of wording, but I think to try to document it, how they should do that specifically is beyond our scope at this point. I do believe that the emphasis does need to be on treatment, and that's going to include best practices. I think that for about 7 years or so, I worked with a company in Yakima where we provided court order services. So they're the kind of services that would come around families in drug court or family court or other things. And a lot of people would not have sought that, except that to create safety in their own families. They were mandated for services that help them to change their thinking and change their behavior. So I do believe that best practices in that is very important. I met just last week, I had the opportunity to have a community meeting with Triumph Treatment Center and their services, and they have a peer support group. They have all kinds of services available. And those are the kinds of services that are going to be available in drug court, wraparound services to help not only the individual, but their families as well. I just think it's critical that we have the legislatures, begin to look at this in a different way. It's not about criminalizing the behavior. It's about recognizing the behavior and putting resources in place, even court mandated through drug court, to change those behaviors for the sake of the individual, for their family, and for our community.
Thank you. Ms. Duvall, you still have your hand up. Do you have further comment?
No, sorry.
Okay, thank you. Commissioner McKinney.
I'm sorry, I need to lower my hand. I don't have to do that.
Okay, thank you.
Commissioner Anderson, if I may add a thought, if you don't mind.
Yes, go ahead.
Thank you. We have a long history in this country of incarcerating people for drug use. We have spent many decades doing that. In fact, there was a very clear war on drugs for decades. It did not cease drug use. It did not improve families' lives. In fact, we are where we are today because of many of the choices that were made decades ago. The amount of money that was placed towards incarceration rather than treatment is quite evident. So I am not dismissing the need or the very real emotional feelings of the board to want to do something to address the issue of addiction. What I'm sharing with you is that I don't believe that the answer is incarceration as a major tool. And I will also share that I think the drug crisis that we have in this country, in this state, and certainly in this county will not be fixed by that. I am sharing with you that we are under-resourced as a system for housing, for supportive services, for drug treatment programs, for job training, for the integration of people back to a community where they are paying taxes and going to work and having health insurance. We are simply under-resourced. And I share that with you in earnest because we are in crisis here. And the other issue that I want to point out is that there is a historic bias in incarceration, in policing, as Dr. Atterbury mentioned, certainly in terms of incarceration sentencing. So we have people of color, men, young men, and specifically African-American men who have been given treatment, or rather sentencing that is severe. And so we find ourselves in a conundrum where we have people who have been impacted by generations of incarceration. It is true that they may have broken the law. It is true that they may have needed to deserve a sentence, but the length of those sentences were catastrophic and traumatic for those families. Also, I want to share with you politely that court costs, the cost of incarceration, are very, very difficult for people who are of modest means, which also sends them back to incarceration. I share that with you in earnest, not because I want to influence your choice in sending this letter, but because I think that the conversations that we're having are not the right conversations. We have a problem in our community. You have a health district that's willing to be involved in the conversation. You have willing support of this staff to address these issues in a way that we can work together, because it's going to take many years. And I just share with you again that that the position of the health district differs from the position of the board. Thank you.
Thank you. Any other further comments or questions?
I would make a motion to approve sending the letter as submitted.
Commissioner, before we do that, Commissioner Lindy had his hand up.
Well, I guess I was just going to say this. I don't have a problem with the letter that is written. I mean, I helped write it, but I also understand the sentiment out here about, there are a couple other factors here, which is that have mentioned. I think Dr. Atterbury mentioned the value of an ongoing, prolonged effort at education, which I think there is certainly a value to that, because we're talking about prevention in that case. And of course, if we can prevent addiction, we're much farther ahead. Tied to that is the issue that I think too much in society glamorize drugs and addiction. And I don't know how to remedy that, but it is an issue and it is a concern. Anyway, that's, I don't have a problem with it as written, but another option might be, since the legislature is a few months away, I think I don't think it's really our scope or our purpose or function to actually give all the answers to the legislature, frankly. But I think we are trying to get their attention to say that we don't like the direction you're going with this law. I certainly favor the idea of stressing education. Maybe we do something like that, something similar that we have with the nicotine or a tobacco campaign. But anyway, those are my thoughts.
Thank you. Commissioner McKinney, you were going to make a motion.
May I speak first?
Yes.
Before Commissioner McKinney makes her motion, I am perfectly open to rewriting the letter. I agree with Commissioner Lindy. I think that our point is to get the attention of the legislatures with how critical this issue really is and how it's affecting our community. But I also agree that, and I don't think I in the letter anywhere mentioned criminalizing by incarceration. I believe that treatment is the most effective and should be the focus. So I'm happy to rewrite the letter with those points in mind and bring it back to the board and see how they feel about it.
Thank you. Commissioner McKinney.
I would, if Patricia, if Councilwoman Byers chooses to, if she's stating that she would be willing to make edits based off the conversation, then I would say that I'm willing to wait until the next meeting.
Okay. Thank you. Any further comments on that or questions?
I'm comfortable with that as well.
Ms. Byers, if I may, I would like to, I can do it now, but I can talk to you too offline. I just have some grammatical changes I'd suggest.
That's fine. Absolutely.
All right, thank you. All right, well, now we will move on to the proposed motion to C, and Commissioner McKinney is specifically to regular meetings, remove the requirement to have an agenda item appear on our agenda in order to hold a vote at that meeting. Commissioner.
I think we've talked about this ad nauseum, so it speaks for itself. My understanding and recollection of our meeting was that we simply needed to have this appear on the agenda so that we could have our vote.
Any further comments or questions?
Call to question.
Stephanie had her hand up.
Oh, I'm sorry.
So I just want to state that I'm against this motion. I want votable agenda items on the agenda. As a new board member, I need time to research and learn and gather feedback from the community I represent about votable motions. I do not want to be blindsided on a potential non-emergency motion, which may lead to voting based on a persuasive argument, but not all of the facts.
Thank you. Dr. Cleary.
Well, I would just echo those exact sentiments. You know, it's a duty of a board member to be prepared for the meetings. And the whole purpose of HB 1152 is to expand the board, to increase the diversity of people on it, and to bring new knowledge, opinions, and attitudes to the board. And if things are put on in a surprise fashion, people cannot prepare for them. Certainly the elected officials should be pursuing input from their constituents. We've had a number of board meetings where Councilman Byers has brought in opinions of her constituents that she has solicited prior to a meeting. And if we do not have something on the agenda, then we're bypassing the public because they cannot provide public written comment. And the optics of this today with the article in the Herald are terrible. I mean, it looks like we're trying to push something through that will allow us to sneak in topics with no input or preparation by the board and no input by the public. So I'm totally against this.
Thank you. Commissioner Lindy.
Yes, thank you. I would just say that I think the whole purpose of an agenda is knowing what we're going to be discussing at the meeting. We have an emergency opt-out, where we can bypass that, but I'm in favor of leaving it as is. I think we and the public need to know what we're discussing ahead of time.
Thank you. There's any further questions? Before we go too far, we have a motion, but we don't have a second.
Commissioner Anderson, we do have Daleen and Patricia that do have their hands up.
Okay.
Yeah, just kind of wanted some clarification in, I watched the last meeting, so heard a little bit of discussion about this, but as I was doing the training as a new board member, part of that was addressing this. And so if I'm reading it correctly, it says that the agenda must be posted by a certain time, but that it does not restrict from modifying the agenda, or nor does it invalidate action taken on an agenda, even if it's not posted according to that time frame. So obviously I agree with the sentiment that we need to be as transparent as possible. And we do want, discussion and input from our community. And I think there should always be a good faith effort with that. But I think Amanda makes a good point that a lot of times these discussions can lead to things that come up that we would better serve the public if we could take action in a more timely manner. And with the meetings being publicized, people can watch them and see that we didn't just surprise throw something on there to throw people off, that it came out of a discussion from an agenda item. And so that, they would be able to see the process that took place. Nor does it mandate that action be taken. We can, as we've seen, just have a discussion and say, oh, we should wait on taking action because we want to get more input and gather more information. So I agree with this motion.
Thank you. We got a little bit ahead of ourselves here. We have a motion, but we did not have a second that I heard anyway. Is there a second to the motion?
I will second Commissioner McKinney.
Thank you. Who made the first motion?
Was that my call to question you're referring to, Commissioner?
Oh, yes. Thank you much for.
It's Dr. Atterbury.
Yes. So there's been a motion and a second, and I think we've already had discussion.
I'd like to say something.
So go ahead. We can have more discussion right now. Go ahead.
Okay, thank you. So while I understand Commissioner McKinney's request with this motion, having served on the city council as well, I will tell you that under new business, we can certainly introduce anything that we want to talk about and even have discussion at that time to move toward making a motion at a future agenda. If it's something that is more emergent than that, we do have a policy for acting on something on an emergency basis with the board's agreement. And I think that's transparent. I think that one of the things, honestly, I don't know how much public input we would get, but I would really like to see this board meeting opened up for Zoom public participation. We have the same thing at City Hall. They have the opportunity to be in person, which we're not doing. So they also have the opportunity to be on Zoom. I just think it might encourage more people to come on, at the moment and really talk about things that are on their mind or their response to things. So just an idea that we might consider doing that. But I just think that the process as it is now, having the opportunity to introduce an item that's not on the agenda under new business and have some initial discussion about that. And at that point, we can decide whether or not it's emergent and change to an emergency ruling to vote on at that meeting. So.
Thank you. Ms. Duval.
Yes, so I'm also I'm not in support of the motion, but I am in support in our current way that we are operating on taking on new motions. And just to show you, we had a whole month to draft a letter. We had a robust discussion about the letters that were drafted, and that is just an example of how well our current motions are working. So I want to keep that going, and it'll make us more efficient. Thank you.
Thank you. Any further comments or questions?
Commissioner Anderson, if I may.
Yes.
I did want to share that the board has a large responsibility in terms of policy and direction to our health district. And so I do want to share with you politely that having a process that's formalized, that's transparent, is also something that we as staff are aware of, is very helpful in terms of our work. The idea of a immediate change to a very large process or program is often very disruptive and also doesn't allow us to incorporate the changes professionally that we want to support. So I share with you that, again, the process that we're following now allows us as staff to position well to do the work. And I do politely remind you that we're in the middle of not one, but two emergencies, including the regular work that we do. And so anything that allows us to maintain an effective support for our staff as they support the community is appreciated. Thank you.
Thank you. Any further comments or questions? Seeing and hearing none, Mr. Ibach, would you conduct a poll, please?
Okay, if you are in favor of the motion as stated on the agenda, please state yes. If not, please state no. Commissioner McKinney. Commissioner Lindy,
No.
Councilmember Byers,
No.
Dr. Atterbury,
Yes.
Councilmember Duval,
No.
Dr. Clary,
No.
Ms. Algren,
No.
Ms. Ackerman,
Yes.
Commissioner Anderson.
No.
So the vote is 3-6, not in favor.
Thank you much. The next item we have under new business, and I think Commissioner McKinney, we covered that earlier. Did you want to discuss that any further?
No further need under my observation. Thank you.
Thank you. Appreciate it. Well, that is all we have for our agenda today. So with no further business to conduct, I would appreciate a motion to adjourn.
Motion to adjourn to our next regular scheduled meeting in August. Thank you.
I will second that.
It's been seconded by Commissioner Lindy. I don't know if we need to conduct a poll on that, so I will just ask for yays and nays. All in favor?
Yay.
Aye.
Yes.
All opposed? Hearing none, we are adjourned. Thank you all very much. It was a great meeting. Thank you.
Thank you, everyone.
Thank you to our new
Yeah.
members.
Great, Lean and Stephanie, welcome to the board.
Thank you.
Yes, welcome.
Bye-bye.
Welcome.